Hello everyone, you are watching the UK's only TV programme dedicated to mental health and wellbeing topics, the Chrissy B Show. I'm Chrissy B.
And I'm Dr. Rob Hicks.
Now, we always tell you on this programme that our physical and mental health are closely connected, and medical issues, especially embarrassing ones, can often lead a person to develop mental health issues. Isn't that right, Rob?
That's right. Physical issues are intimately related to our mental health and emotional problems. So if you have a physical problem, chances are you're going to get stressed and anxious about it.
Yeah, which is why we always love to cover medical issues on this programme. So today we're going to be covering a few different areas to help you, our viewers at home. And Rob, what are these areas?
Well, we're going to be talking about excessive sweating with consultant dermatologist Dr. Anton Alexandroff.
And also Anton's going to be talking about excessive body hair.
And we're going to be talking about bad breath.
Also incontinence.
And there will be Doctor's Answer session with me talking about burps, farts and lots of other lovely things.
Lovely. So let's now go straight to our first areas, which are excess sweating and hair. Hello, Anton.
Yes, hello.
Lovely to see you again.
Very nice to see you. Thank you for inviting.
So now we're talking about a completely different subject, Anton. So we're going to talk about two things now, which is we're going to start with the excess sweating. So now this is a problem that many people go through, and of course it is embarrassing. I've known a friend, for example, that she was always embarrassed to shake people's hands because her hands are always wet, and she felt really bad about it. But can you tell us, first of all, why do we need to sweat in the first place?
It's quite simple. It's the way we regulate our temperature. If we're about to overheat, when the sweat glands kick in and we produce sweat, and sweat evaporates and cools us out. So it's to make sure we don't overheat.
Okay. And why is it that some people sweat more than others? So, for example, in my case, I can go and do a workout of quite a vigorous class and I sweat a bit, but then there's other people that are just drenched in sweat. So what's the difference between people?
Generally, it's a genetic, depends on the number of sweat glands and also the size. For example, men generally sweat more because of biologic reasons, but also there are a lot of triggers which can make you to produce more sweat.
Okay.
So,
yeah, sorry, go ahead.
Yeah, in every individual patient, you can trigger excessive sweat production or extra sweat production.
And what actually causes the excessive sweating? Where does it sort of go from being normal to, okay, now it needs to be treated?
I think it's a bit subjective, really. It depends what people feel and think. I think in general, maybe about 1% of population considered to be sweating above and in excess of normal sweating, but it's subjective. You know, for me and you, it can be different. Some people say that it's just normal for them, some people think it's excessive, but obviously people need to take, for example, if people need to change tops 2 or 3 times a day, that sounds like excessive. And if as you say, if you shake hands and it's always sweaty, some people can feel embarrassed about this. But in general, it's very subjective, and patients come to me sometimes and I feel that it's probably they sweat as much as I do, but it's difficult because for them it's important. And obviously for other people, we have to change tops 2 or 3 times a day or more often. They can't wear white tops, for example, because of this, and so on.
Yeah. I mean, what are some of the worst cases that you've seen in your career?
Okay, well, there are people, patients coming to see me, and you clearly can see that where armpits completely soaked through, maybe back and chest as well. So we're actually sitting in front of you, and you can see where just covered in sweat.
Okay.
Yes, and when I shake my hand with you, it's just completely wet.
Rob, if you have any questions, please feel free to ask, because I've got a few more.
I mean, Anton, it's, people often talk about the hands that are wet, but there are other parts of the body that get very wet as well, aren't there?
Yes, absolutely. Any part of the body can particularly be sweaty, but it's usually hands because you shake hands, and armpits because you can see. But it varies. It varies. And it can be, of course, generalized sweat as well. So generally, it's increased everywhere, but patients or people in general pay more attention to particular body parts.
And what can actually be done about excessive sweating, Anton? What are the treatments available?
There are lots of treatments. I guess first of all try to minimize the triggers. So for example, caffeine, alcohol, spicy food can make you sweaty or cause sweat. For example, in pepper, hot spicy food, capsaicin.
Oh yeah, that makes me sweat. Yeah.
It acts like it triggers the brain to think that there is hot temperature. So you start sweating if you eat spicy food, peppers, because of this. But also, for example, synthetic fabric can make you more sweaty.
Oh, really? Okay.
And not just wearing cotton or silk, for example, might be helpful. And there is a range of medical interventions, starting from very simple, like antiperspirants, for example. There are some very effective medical-grade antiperspirants, dry chlor, for example, aluminum chloride. But sometimes it can irritate skin, whereas treat how to use it properly. And then if it is not effective, then there is iontophoresis, which is usually very effective, which is a mild electric current, which can be given to hands or feet or any part of the body, really.
Okay.
And it's usually very, very effective. Like I had a patient, for example, a 25-year-old girl who was very upset by the very sweaty hands, and it worked really well for her. Another good treatment is botulinum toxin, Botox. So it's usually used for wrinkles.
Oh, okay.
But it can
You
be
use it for sweating?
Sorry?
You can use it for sweating, really?
Yeah,
Botox.
absolutely. Very effective treatment. So especially for armpits, sweating. So I had a doctor, something like 29-year-old, and she obviously had to come very close to patients to examine them because of the job. And she was very embarrassed. So we started her on the Botox injections and solved the problem. She was very happy. Botox is very good, but it only lasts for about 4 to 6 months, so you need repeated injections.
Oh, you need to repeat it, okay.
And there are some medications as well. So there are medications which we call antimuscarinic medications, which generally reduce sweat. If sweat is triggered by anxiety, like some patients, then beta blockers can be extremely effective, and sometimes we actually resolve the problem, settle the problem, because people become less anxious, and after that they may not sweat at all when they're anxious. So there are lots of different medications which can be tried as well.
Okay, Rob, do quite a few people come to you as well with this kind of problem?
They tend to mention it as a sort of secondary problem. They'll normally come with another problem, and then they will say, "Oh, is there anything that can be done? Because I think I sweat a lot." Do
you think that because they're embarrassed to talk about it?
Yeah, I think so. I think so. Or they just think that it's not a medical thing. It's not a doctor's role to help. You know, they've tried an antiperspirant and that hasn't done the job, but they're not aware, as Anton has said, that there are sort of medical grade antiperspirants that we can prescribe that are stronger and tend to be more effective for somebody. But then often I'll get somebody who says, well, look, you know, I can't do the job because my hands are so wet, I keep dropping the tool. Oh, so can you help me with that? Because I don't want to stop working in this field.
I didn't even think about that. It's true.
You know, or the fact that they're finding that they can't use a keyboard because their hands are so wet that they're slipping off the keys. So it's not just the visual signs and the embarrassment signs. There are often the practical signs, you know, or symptoms that they say, well, I can't do sport anymore because the tennis racket keeps slipping out of my hand. You know, so
many implications,
there are lots of genuine reasons why people should come along. Yeah. They shouldn't feel embarrassed because it's not anything that they've done wrong, but there is something that can be put right. Okay. I mean, sometimes, Anton, people have operations, don't they, for this problem? Yes,
it's the last resort, really, because you cannot undo operation. And what unfortunately sometimes happens is that there is excessive sweating in other parts of the body, which can be very difficult to control. There is actually a very new development in the field. There are special deep microwaves, which are now licensed in America and Europe, but not yet in the United Kingdom. So we actually inactivate sweat glands inside of the skin. So, and this is relatively new data, it's about 2 years, but so far it's actually very good data. It looks like we currently can destroy sweat glands in this area.
Okay. Oh, that's good. Just one more question before we go to a break. We're going to have to cover the excessive hair in the next part, Anton, so we are going to keep you on. But just still on this subject, regarding sometimes when people sweat, it can smell quite strong, and that also varies from person to person. Why is that?
It's called bronchidrosis, and what happens is that there are some chemicals which can be which can go into the sweat. It quite often depends, sometimes it's medications, but quite often depends on the foods people eat, for example, garlic or onion or broccoli or cabbage.
Really?
Yes, and these food, let's say the chemicals, they contain sulfur and chemicals with sulfur, and that's why it smells this way.
Okay.
So not easy, but one of the logical solutions, try to eat less of this. Foods, even though sometimes they can be very tasty and delicious.
Yes.
and then the other things, try perhaps to take a bath or shower every day, wash the armpits with antibacterial soap, so wash off bacteria, so it doesn't convert these sweat into chemicals. Shaving armpits actually can be quite helpful.
I was going to ask that, yeah.
Sweat evaporates sooner and faster, and bacteria tend to stay there.
A lot of men don't like to shave under their armpits because they think it's too feminine, but it just smells better, doesn't it?
It depends, yes, if it smells or not. It's quite practical.
Yeah, I think it's good. All right, so did you have any final questions for Anton?
No,
I think
we've covered it.
All right, so that was all about the sweating, everybody. Anton, as I said, we're going to keep you on because after the break, we're going to be speaking about the excessive body hair and also bad breath, so don't go away. Welcome back to today's show, everyone, where we are discussing embarrassing health conditions that people sometimes find difficult to talk about. So we've covered excess sweating with Anton in the first part of the show. We still have him with us now to talk now about excess hair. And afterwards, we're going to talk about bad breath with Rob. So Anton, let's talk about the excess hair now. So can you tell us what causes that in the first place?
Okay, well, generally, there are two types of excess hair. One is a general excess hair called hypertrichosis, and this can happen in men or women, ladies. And there is also hirsutism. Hirsutism is slightly different. Hirsutism is excessive hair in male pattern of distribution in ladies. So, talking generally about hypertrichosis, excessive hair, very often it's genetic, runs in generations, or generally depends on genes. But sometimes it can be treated by particular drugs, not very common, but can be done, for example, by steroid drugs or epilepsy drugs or some dermatology drugs we use. Sometimes it could be because hormones do not work very well, like underactive thyroid, for example, or some dermatological conditions like porphyria. So porphyria, for example, is a disease where people react to sunlight not very well. We can basically have a kind of sunburn from this or effects to the skin, but also it can stimulate hair production, hair growth. So maybe that's why in the past there are legends about werewolves and vampires, that kind of stuff. The another common condition is actually just predisposition genetic. And when we speak about hirsutism, which is excessive hair production in male pattern in ladies, this again can be caused by genetic predisposition, but also can be because of androgens or male hormones, which in ladies produce either in adrenal gland or ovaries. And in general terms, generally speaking, if hirsutism is present, it might be a good idea to speak to your doctor to see if this needs to be clarified and excluded. But one of the common situations is polycystic ovary syndromes, which is quite common, excessive hair hirsutism, hair loss on the head, and difficulties with conceiving and irregular menstruations. So that's very common. But general, I guess, hirsutism, in one of the studies, up to 10% of ladies actually experience excessive hair. So this is the situation.
And what are the treatments available, Anton? I mean, would be things like laser and IPL, or are there other methods out there?
Lasers and IPL, intensive pulse light, are very close, these two treatments. They're generally very good, especially for people with white skin. In patients with skin of color, it can be a bit more challenging because these modalities of treatment can cause sometimes change of the pigment of the skin, or it might not work as well. Electrolyzers can be quite good permanent solution for hair removal in patients with any type of skin, really. And also there is a cream called Vanica, which is a hormonal cream. It doesn't actually cause hair to disappear completely, but it slows down how quickly hair grows. So you don't have to remove it as often, maybe 2 or 3 times less often. And that's quite good among ladies. And of course, there is lots of different ways of non-permanent hair removal as well.
I mean, is there anything, first of all, that people can do before that maybe consulting an expert or dermatologist that they can do themselves, or is it something that you need to get the help with? Would you say?
Well, I think, I mean, with this problem, it's only a medical problem once it's a problem for the person, because there are plenty of people who will have, plenty of women who will have more hair than perhaps other women, but it isn't an issue for them. But when it becomes an issue, maybe it's a moustache, it's a beard, it's hair on the chest, hair on the back, as Anton says, in a male pattern distribution, then the women obviously become a bit more self-conscious and embarrassed about it. So you've got shaving, you can pluck the hairs out, you can go through the waxing, and it all depends very much on how much hair there is and the distribution and how permanent you want it to be. So somebody might say, well, actually, I'm happy to go and have it waxed or treated, every couple of months, because I know that it'll go away for a while, it will come back, I'll need it treated again. Or somebody might say, well, actually I want to have laser where I can get rid of it, and hopefully not have to do it ever again. But then waxing is cheap, it's painful, it's cheap, but electrolysis and laser is expensive, so you've got all these different things to weigh up.
Okay. All right, Anton, thank you so much for your participation.
Always happy to help.
And we'll see you again soon, hopefully, because we would like to talk about hair loss one day, which will be a very interesting one. So call upon your services then as well. Thank you so much.
Thank you for inviting. Thank you.
See you.
See you.
All right, guys, so now we're going to talk, we've got a few minutes left to talk about bad breath. So, Rob, tell us all about that, why it happens and what people can do about it.
Well, this is a really tricky one, isn't it? Because if you know somebody who's got bad breath, do you tell them? That's the question. And I think, often a good friend would actually say to you, you know what, don't take this too personally, but your breath smells a bit. And I think that can be really, really helpful. And generally speaking, it's because, why does it happen? You get bacteria that accumulate on the back of the tongue. They release a toxin, or toxins, and it's the toxins that smell. So every time you breathe out come these odorous toxins into the air, and so other people around you sense they smell the bad breath. Gum disease is a really common cause of bad breath, and if you are, if you want an excuse for raising the subject with a loved one or a friend, say, well, that gum disease might be a problem. Why don't you have a checkup with your dentist, and then and you can raise the subject that way. The other thing is, it's often like with sweating. If you eat garlic, the smell comes out in your sweat. Spicy foods and what we call smelly foods are likely to add to a smell on the breath. Alcohol, caffeine does it as well. But I suppose
you can kind of tell when it's food related, can't you? When you've had garlic or when someone's had smoke,
it is different. And you get some rarely, it's not that common, but sometimes it's medical conditions like acid reflux that are causing the bad breath. But for the vast majority of cases, it's a collection on the back of the tongue or gum disease that's causing the problem.
Okay, and the main, apart from the obvious things like brushing your teeth and flossing, is there anything else?
Well, you say obvious, but people even forget that. Brushing teeth, yes. flossing and scraping the tongue to get rid of this debris, and having regular dental checkups as you're advised to. Drinking lots of water, not smoking, cutting down on alcohol, the odorous foods, cutting down on caffeine, chewing sugar-free gum is another way, because it stimulates saliva, which helps cleanse the mouth, so you're not getting so much of a collection. But again, with bad breath, I think your first port of call is your dentist.
Okay.
And then if the dentist thinks that there might be a problem related to a medical condition, then they will, of course, send you, to see us as a doctor, because sometimes it's an infection that actually is causing the bad breath, but then that tends to be a more temporary thing.
And with the tongue scraping that you mentioned, would that just be done with a normal toothbrush, or is it something specific that you need to use?
You can use a toothbrush. You can use the back. Some toothbrushes now have behind the bristles. There's a scraping device. There are plastic scrapers. There are all sorts of different they're not expensive, and it's like brushing your teeth and flossing. It's about getting into the habit of doing it, making it part of your dental and oral health care routine. And again, if it is a problem, sometimes it's not easy to tell whether you've got bad breath. But if you want to check, you can lick your wrist, let the saliva dry, and then have a quick smell of it, and that'll tell you one way or the other whether you've got bad breath.
Oh, okay. All right, interesting. Well, Rob, we do have a video now actually showing, well, obviously we know that good dental care is vital, and eating lots of sweets and junk food and all that kind of stuff will rot your teeth if you don't look after them properly. So we've got an alternative here for some strawberry gummies which don't contain sugar. So let's take a look.
Hi everyone. We all know strawberries are good for our health. But did you know they're also great for our teeth? They contain malic acid, which is a natural tooth whitening agent. As soon as I learned this information, I set about making something nutritious and delicious. So without further ado, it's time to show you how to make my yummy strawberry cream gummies. Let's get started. These delicious gummies are a great gluten-free treat you and your loved ones can enjoy instead of the unhealthy sugar-filled kind you can buy at the store. Begin by pouring coconut milk into a small saucepan. Add fresh or frozen strawberries that have been thawed and chopped, and cook over a medium heat to soften. Once strawberries are soft and your milk begins to gently bubble, turn the heat off and use an immersion blender, a fantastic affordable kitchen tool to blend the ingredients together. Be very careful when doing this, as contents are hot. You can wait until everything cools down to perform this step if necessary, and once blended, turn your stove back on to a medium heat and wait until the mix begins to simmer. Whisk in agar powder, which is a tasteless plant-based gelatin that's a great source of calcium, iron and fibre. This is the magical ingredient that creates the gummy texture. Once the mixture begins to thicken to a cream-like consistency, it's ready to pour into a silicone mould or a small container lined with baking paper. Leave to set in the fridge for at least 1.5 hours before removing them from their mould. These gummies are best stored in the fridge and can be kept for up to 1 week, if they last that long. For the full recipe, please visit www.chrissybshow.tv. Thanks for watching.
So thanks very much to Danielle. So we've got a couple of minutes before the break, Rob. So can you tell us a bit more about how bad breath affects people psychologically as well?
Yes, I think it's often underestimated, isn't it? The fact that this is a very sensitive issue. For many people, it's an embarrassing issue. But what it does is it keeps them away from people. So it might keep them away from a loved one. They may not want to be intimate with a loved one. They may not want to kiss a loved one because they're worried that the loved one actually will be put off by their breath. Or it may work the other way, that the person with the bad breath may not know, and then the loved one doesn't want to become intimate, and then the person with the bad breath thinks, well, why don't you want to kiss me? What's going on? Yeah. And all these sort of worries and concerns start breeding. But then there's the other side, is people will stop going out. They'll stop socialising. They may not want to go too close to people in an office. They may not want to go out and party because they just feel so awkward about it. So they become socially isolated. They become anxious and stressed. That makes the problem worse, because if you've got dry mouth, because you're anxious, you're more likely to develop, you're not cleansing the mouth, you're more likely to develop the bad smells because of the collections. And then, of course, the knock-on again is depression. And
you see how all these things are linked. It's amazing, isn't it?
Health is, health and illness are linked very intimately, and you get this domino effect that it only takes one person to say, "Oh, your breath is stinky," and then you think, then the person remembers that, and then they're very self-conscious of it, and so they do everything in their power to avoid scenarios. The other thing, of course, is people use fresheners to try and mask it. Well, all that does is mask the smell temporarily, which may help, but you want to try and get to the root problem and treat it.
Okay.
And for the majority of people, that's possible.
Yeah. Okay, Rob, thank you. But you're not going to go away, because after the break, we're going to be speaking all about incontinence. Hi, I'm Chrissy B, and my show is all about improving your mental health and being happy. Join me every Monday, Wednesday and Friday at 10 p.m. on my channel Sky 203. Visit chrissybshow.tv for more information and subscribe to our YouTube channel, Chrissy B Show. You can also follow us on Twitter and Instagram at Chrissy B Show, and on our Facebook page, The Chrissy B Show. Welcome back to our show today, all about embarrassing conditions. So we've covered excess sweating so far. We've also covered excess hair. We've covered bad breath. And now it's time for incontinence. So Rob, can you tell us what incontinence is? Well,
incontinence is essentially the passing of urine or indeed feces when you don't want to. So you've got no control over it. So we call it the involuntary passing of these substances.
Okay.
So urine incontinence is far more common. In the UK, somewhere between 3 and 6 million people suffer with some degree of incontinence. And so, and for some people, it's not a problem. But at the other end of the spectrum, for other people, it's a major problem. Because, of course, they don't like leaking. They don't like feeling damp all the time. They don't want to go out. Obviously, they're concerned that people can smell the damp clothing. So there are two major types of urine incontinence. One is stress incontinence, and this is the type that happens when there's pressure on the bladder from laughing, coughing, sneezing, exercise. And we see this commonly in women, particularly women who perhaps are overweight or have gone through pregnancy. And the reason it happens is because the pelvic floor muscles, these are like a sling of muscles that support the bladder, get weakened or damaged. So any excess pressure on these muscles weakens them, which means that they're not strong enough to keep all the urine in when they're put under further pressure. Okay. So you cough, little urine comes out. Exactly. So that's one of the most common forms.
I had a friend actually that had a baby, and she said she just couldn't do any exercise afterwards because she tried to do like a jumping jack, and she would just wee herself.
Absolutely, and that's the typical story, because of the excess pressure that's put on the bladder, and the muscles aren't strong enough to hold the urine in. Then you've got another type, which is called urge incontinence, and that's when people, obviously, they feel an urge to go, and that's because the muscles in the bladder are overstimulated, and they're stimulated just out of the blue. And that might be because of effective drinking of caffeine, alcohol. It might be effect of infection. It might be an effect of some medication. It might be an effect of nerve damage. So these are the people who get a sudden urge to go, and they may not make it in time. To the toilet. So those are the other two major types.
Okay. And so what can the person do, maybe themselves first of all, like to try and...
Well, the first thing to do is actually, even before you go and see a doctor, is to do the pelvic floor muscle exercises. And you find those muscles, they're the muscles you use if you want to stop doing a wee or you want to stop breaking wind.
We've actually got a video on that, Rob. Shall we take a look? We've got Jane Rafter actually talking about this, so let's take a look.
Hi everyone, welcome to your fitness tips. This really is one for the ladies, okay? So I want to talk to you about strengthening your pelvic floor. If you've had a baby, I'm sure that you will have heard of this, and your midwife will have talked to you about strengthening the pelvic floor. If you haven't, it's worth knowing about it before, because if you strengthen your pelvic floor before you have a baby, you have a much better chance of your pelvic floor remaining intact after birth. So a great way to strengthen your pelvic floor is to go to Pilates or yoga classes. Both those classes incorporate the use of the pelvic floor. So to strengthen it and to initiate it, all you need to do is imagine you're on the loo and you're stopping the flow halfway through. So it's an internal squeeze. And the beauty of this is you can do it anywhere, anytime. So if you're sitting on a bus or washing up or driving your car, you should always think about just strengthening the pelvic floor. So you take a breath in, and as you exhale, draw the internal muscles in. And you might notice a tightening across your lower tummy as well, which is a good thing because the pelvic floor works in tandem with your deep lower abdominal. So you can always exaggerate that and pull that in as well. Just try not to pull a funny face when you do it. Okay, so get on those pelvic floors, girls, and I'll see you next time.
So thank you to the lovely Jane. So she spoke about the pelvic floor, Rob. So what are the things, okay, so that's what you would do maybe before you went to your GP.
And actually, while we were watching the video, I was doing a few pelvic floor exercises.
So men can do it too?
Men should do it too, yes.
Okay, right. So tell us about what else then, once a person has reached a stage where maybe they need the extra help, what can they do?
Well, some of the things they can do, cut down on alcohol and caffeine. And also, if necessary, try and lose weight, because that will reduce the pressure on the bladder. And sometimes it's because somebody's got constipation that actually is contributing to this problem.
Yeah.
So make sure your bowels are working healthily. The key thing is if it's a problem for you and it's then go and get it checked out. It might be that there's some kind of low-grade infection there that can be treated.
Oh, right.
So there's lifestyle stuff. There's the exercises. There's bladder training, which are a continence advisor, and there are clinics all around the country where people can go and speak to experts who deal with this problem day in, day out. You can retrain your bladder, to be able to hold on for more than 30 minutes an hour, up to 3 or 4 hours between going to the toilet, and that works a lot for many people. Then of course, from the medical point of view, we've got some medicines we can use that actually will reduce the chances of leaking happening. It will reduce maybe the nerve triggering the muscles to contract, so that's available. Some other things that people do, you can do at home. You can get cones and you can get electrical stimulators for women that are used to help strengthen the muscles. So you don't just necessarily do the exercises.
Yeah.
You're using something to squeeze.
Yeah.
And then you build up with the size of the cone to increase, muscle tone. Now we do help. Sometimes it's necessary to do surgical procedures, and for stress incontinence, what we can do is we can strengthen those pelvic muscles with a form of tape. Lifts, supports the bladder, and actually strengthens the muscles. And there are different ways of doing this. There's also some injections.
There's so many alternatives.
Oh, there's loads. There's absolutely loads.
There's no reason for someone to suffer in silence, because it does affect you psychologically as well. Again, you don't want to go out like with some of the other conditions that we spoke about.
I mean, many people use absorbent pads, and there's underwear that's got built-in pads, but many people don't want to have to rely on that.
Yeah.
So they use that as like, as like a sticking plaster. Essentially, it sort of treats the symptom, but it isn't resolving the problem. And then, as you say, psychologically, people are concerned that they're going to have a leak and it's going to be visible in their clothing. They're going to be very, very embarrassed, obviously, by that. They're going to be concerned that people might smell the urine. So what do? They say, well, best if I don't go out.
Yeah,
so they stop socialising, they stop going to cafes, they stop going to restaurants, they stop going to the theatre, because the other thing, and this is a problem for men as well, with prostate problems, which can contribute to leaking, is that they're terrified they won't be able to get to a toilet in time. So they stop going on outings, they stop socialising, they stop even going to the shops. One of the things that people can get hold of is what's called the can't wait card. And which actually is a card that has written on it, I've got a bladder problem, please give me access to your toilet. And the other thing that people can get hold of is a key to locked public toilets around the country. It's the National Key Scheme that's available through Disability Rights UK. It's also often known as a radar key. But it's about boosting somebody's confidence. It's not just about treating the problem, it's boosting their confidence that, you know, in the time it's taken to treat the problem, this is what you can do to help yourself and actually to get your life back. And at the end of the day, that's what we want for people. Too often in medicine we focus on just solving the problem of, okay, no leaking, but we don't look at the emotional aspect that's happened, because people may, even though they may not be having incontinence anymore, they may have a memory of when they had an embarrassing situation, and they're reminded of that every time they meet with a certain friend who might have been there. They go to a certain place, and at the back of their mind they're thinking, oh goodness, is it going to happen again? Is it, you know, am I going to get caught out again?
That's such an important point, Rob, because people, like you said, they kind of solve the medical issue, but then you've still got that baggage that kind of was created when you were going through all those things, and that can even affect you in other areas of your life.
Yes, there is this knock-on effect, and if you think about, you know, sexual relationships, people are really turned off sexual relationships if they think they're going to be incontinent during lovemaking. So there's all these different areas, but I would reinforce the message, which is your doctor's not going to be embarrassed. So you needn't be embarrassed about coming and raising the subject. And once you do raise the subject, often that's the hardest part. You've overcome the hardest part. You've crossed that bridge. From then, it's plainer sailing.
Okay, and just a final question as well, Rob. Can, for example, like just maybe eating healthily and these kind of things, does that help in any way? Or is
Definitely. We've already talked about exercise helping with the pelvic floor muscles. Eating healthily helps you maintain a healthy weight. So if you're thinking that being overweight is a trigger for this problem for many people, then of course it does. Yes, you're absolutely right.
Okay, so we are going to go to a break now, Rob, but again, after the break we're going to be having our doctor's answers session, so we're going to be answering some questions from people, and these questions include hiccups, farting, burping, and I can't remember the other one, but we'll get to it after this, so don't go away. Welcome back to today's programme, where we've been speaking all about embarrassing medical conditions. Now, this is now our doctor's answers section, so we're going to be answering a few of your questions. But first, before we talk to Dr. Rob again, eating right can actually prevent all sorts of health issues, and this simple recipe in particular contains vegetables that has been said to reduce excess sweating and is also good for all-round health.
Hello and welcome to the MTS Kitchen. My name's Hannah, and today we're going to make some breakfast peppers. So, first of all, you can take any peppers, green, red, yellow, orange. The sweetest ones are the orange ones, I think, so we're going to use them. And I've just cut them in half, cored them out, and put a bit of olive oil on them. So I'm just going to put them into the oven, just to soften them up a little bit. Okay, and so to make the middle, to stuff the peppers, we're going to do a scrambled egg mix. So I've got my red onion. So just dice the red onion up into the smallest pieces you can manage. Just going to put half a red onion into the bowl. Then I'm going to take a tomato for some colour. So breakfast is all about making sure you get in all your good healthy fats, your good fibrous vegetables, and a bit of protein as well. And then just for a little bit of spice, we're going to add some chili. There we go. So, all the ingredients are in here now. I'm going to do a couple of pinches of sea salt and some black pepper. And then I'm going to crack 2 eggs into the mixture. So now I'm going to take the peppers out of the oven. They've just been in there warming up for about 5 minutes, about 180 degrees. So we're just going to pull them out now. So we're just going to put them there. Do be careful because they'll be hot. And then just very carefully start spooning in the mixture. So it's been about 20 minutes. I'm going to pull the peppers out of the oven now. Garnish it with a bit of coriander and a bit of black pepper. Bon appetit. Stuffed peppers.
Thank you very much to Hannah. Right, so Rob, Doctor's Answers.
Doctor's Answers.
This is a section where we are answering viewer questions. Right, so I've got a number of different areas here. We'll try and get through as much as we can. So the first one is all about hiccups. And this person's saying, I tend to get uncontrollable hiccups for no apparent reason. And I try all the old tricks in the book, holding my breath, ice cube down my back to try and stop, but they just get louder and seem to go on for ages. What do I do?
Well, what do you do if you've got lots of hiccups? Well, you try different methods, because one of the things that people find is a little bit of trial and error will actually get rid of the hiccups. That we don't actually know precisely why they happen for most people.
Yeah.
We know the mechanism, but we don't know what's triggering them. So what happens when you get a hiccup is the diaphragm, that's that muscle that separates the chest from the abdomen and is involved in breathing, it spontaneously tightens. Yeah. That draws air in very quickly, but there's something at the top of the windpipe that shuts, and that's what gives the little boop sound. And of course, once somebody's done it once, they're more conscious, and then you're more likely then for it to happen over and over again. So there are some things you can think about. So hiccups are often associated with eating too quickly. Sometimes they're associated with coffee, alcohol. They may be associated with bloating. They may be associated actually with anxiety. So if you're worried about something, you may find that your hiccups are happening more frequently. Okay. So try and pinpoint those sorts of things.
What about sort of taking in too much air? Like if it's a windy day and you just happen to maybe block nose and like there's loads of air going in your gob?
It might be. I mean, often it's actually people eating too quickly. That tends to be related to hiccups. Mm-hmm. There are some medical conditions that are rarely associated with hiccups, so irritable bowel syndrome, for example, indigestion is another one, asthma is another one, but these are very, very, very rare. Generally speaking, we don't know what's triggering hiccups in an individual. But some other things that you might want to try, in addition to the ones you have tried, actually biting on some bitter lemon, that might help. Actually drinking some cold water, and when I was growing up we always used to try and drink it from the far side of the glass. It got a bit messy, but that was one way of doing it. Eating granulated sugar is another thing as well. So there are lots of different methods, but actually what people generally find is that they find one thing that works for them, and then when it happens, stick with it.
Okay, cool. So we have another one. This one's to do with burps. So this person's asking, why do I burp after any meal?
Right, well, burping is just the body's way of getting rid of excess air from the stomach. So, you take in air when you're eating or when you're chewing something, and then you have to get rid of it. So generally speaking, if you're burping, it's coming from the stomach. If you're passing wind from further down or farting, it's coming from further down in the intestine. Why is it happening? Well, it's because you're taking in too much air. So drinking fizzy drinks, talking whilst you eat, not chewing properly, eating too quickly. It's true to say that some medicines will increase the risk of burping, as will some medical conditions. So irritable bowel syndrome, indigestion as well may be trigger some burping as well. But it's normal. It's a normal thing. So
But don't do it at meal times when you can hear it. That's disgusting.
Try and go outside the room to belch when you need to. Yes.
Just linked to this as well. So sometimes when I burp, it seems like I'm bringing up some of my meal, even though I don't feel like I've overeaten.
Yes, well, some people who've got acid reflux, that's when acid from the stomach and the stomach contents is coming up the gullet into the back of the throat. If they're burping, then sometimes that's what you're tasting. You're tasting the acid. You're actually tasting the food because maybe the stomach's overfilled. So the trick then is obviously to eat more slowly, to take more time when you're eating, and maybe think of having smaller meals but more often.
Okay. Oh, we've run out of time quickly. Okay, so this one's about farts. We've got 3 questions about farts, Rob. Okay, so this one's saying, sometimes I get really bad wind and find it very hard to prevent myself from letting it out. Is it normal not to be able to control breaking wind?
Well, it's actually normal to break wind. I mean, we all do it every day, and the average is around about 15 times a day. And that, again, it's about getting rid of the excess air from the gut. Why does it happen? It's because we take in too much air, but also there are sort of poorly digested foods that get down into the gut as part of the process of them being digested by bacteria. Gas is released, and and therefore we expel the air as a fart. Sometimes it's smelly. Usually it doesn't have an odour whatsoever. But again, it's a normal thing. The difficult.
Sorry.
You've just passed on, haven't you? It's a very normal action.
Yeah.
And again,
I love this show. We just talk about everything. Don't we?
I mean, but these are the things that trouble people.
Yeah.
If you're passing lots of wind, then there are things you can do to reduce it. So obviously, try and reduce how much air you're swallowing. So again, eating more slowly, not having carbonated drinks, fizzy drinks. We often find people who chew gum tend to get more gas because that takes the air in. They're taking more air in than they need to.
Okay.
If you're worried, but on a serious note, if you're worried about the wind you're passing because it's you've got tummy pains or maybe you've got some bleeding from the back passage or
definitely get that checked out.
Get that checked out.
Actually, I don't know if this links as well because this one says sometimes my farts are really smelly. Is this a sign of something wrong internally?
No, generally it's not. It's just as simply that there's sulfur, rotten eggs gas being produced, and that's the reason why.
And this person's asking, does holding in wind cause any damage inside?
No, it doesn't. The only thing it might do is actually make people feel uncomfortable and a little bit of pain because that gas is there. It's building up. It wants to be let out.
Okay.
So
make sure you don't explode.
So make sure you don't. Just there used to be I think it was a Scottish adage that said, "Where airy be, let your wind blow free."
Okay. But not at the dinner table. We keep saying that, right?
No, try and do it somewhere private.
So, Rob, we've got time for one more. This one's now to do with yawning. Why do I yawn if I've had enough sleep? Yawning seems to come out of the blue, and I don't want to give the impression to other people that I'm bored or not interested in what they're saying.
This is a fascinating one because for many years we thought that actually yawning was trying to get more oxygen to the brain because people were tired or they weren't concentrating very well. But there's been some research recently that suggests actually the process is to try and cool the brain down, and that brings more alertness, better concentration during times of fatigue and tiredness. And you'll also notice that if you yawn, other people around you start to yawn as well. It's sort of contagious. Yeah. So if you were to yawn, then I might.
Why is that?
It's nobody knows precisely why, but it's thought it might be some kind of alert mechanism. So to tell people around you that they've got to be more alert, either because they're in a meeting, but also in olden days because they may have been on the verge of attack by somebody. So you'd yawn, become more alert. Other people would naturally do it as well, so that they were prepared.
Because when I was in Kenya once. I don't know if you know that baboons do that as well when they feel threatened.
Yes.
So I was on holiday and I was going really. There was like a whole bunch of them with little ones as well, and I went up really close, and they all started yawning. And I'm thinking, they're all tired. And then the guide said to me, "Get back now, because that is a sign that they're getting agitated and they could actually attack."
So they're getting they're threatened.
I was very much in danger.
So rather than seeing yawning as a sign of boredom, actually see it as a sign of preparation and increased heightened alertness.
Okay, well, Rob, that's all we've got time for with the questions. Thank you so much.
You're welcome.
And actually, guys, if you have a question for Rob, don't forget you can get in touch with us via the website, chrissybshow.tv, and we can have some more sessions like this, Doctor's Answers, and Rob can answer all your questions at home. And also, we have a playlist called Doctor's Orders, and where Rob covers all sorts of things, all sorts of medical conditions. And if there's one that you would like to see in particular, let us know the subject. Well, we have reached the end of today's programme. It's been a good one, hasn't it, talking about all these things?
We're no longer embarrassed.
No, not embarrassed, guys. Make sure to always seek medical advice. Don't be embarrassed, because you can get through these issues and there is help out there for you. Until next time, bye-bye for now. 4 areas to help our viewers at home. Is it 4 areas?
Talking about burps, farts and lots of other lovely things.
But first, let's go straight to our... Oh, silly cow. So let's go straight to our first areas, which are excess sweating and hair, and we also have consultant dermatologist. I will get this right. It's the pressure of doing this with Rob because he's such an expert at... Stop it. It's too much pressure for me.
I'll just have a sip.
We're also going to be talking about excessive body hair, and again with Anton.
Sorry.
Can we just get a wide shot of Rob waving as well, please? Which one? Hang on, which camera? Okay, middle one.
Outtake City.